Do I have a bag under only one of my eyes? If so, how do I fix it? People constantly ask me if I have a black eye because my right eye keeps getting what I can only guess is a bad bag. Is that what it actually is? And what can I do to fix it?
Thank you for your question. You submitted your question with a single photo, and you're asking if you have one significant under eye bag compared to the other eye, or is there a reason why people keep asking you if you have a black eye? Well, I can certainly share with you how I discuss this type of concern with my patients in the absence of more detailed views of your eyes and physical exam. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people have better-looking eyes has been a big part of what I do every day in my practice. Everything ranging from treating under eye bags with surgery, as well as with injectables, the use of lasers, and all other technologies and techniques to help people look better. So I can guide you a little bit about what I do when I make an assessment of discoloration or perception of discoloration. Now, when I look at your photo, it does appear that there is a difference in the color of an area under one eye compared to the other. One area looks like there is pigmentation. So when patients come to me, and often a common concern is about dark circles under the eyes, I explain that essentially we have to look at the anatomy, whether it's from the outside in or the inside out. It would have to do it in a way that is logical and sequential. So let's start from the outside in. When you start with the outside, you look at the skin. In the skin, what is responsible for the perception of pigment? Is it from the external skin having a lot of pigmentation from sun exposure or from previous trauma? Is it pigmentation that you have always had, such as one that you were born with? And that type of pigmentation brings to mind conditions such as something called nevus of Oda, or different types of melanosis, where there's high concentrations of pigment in an area that is something you were born with. Further, as you go further back, you also look at the shadow under the eyes, and that is often the result of genetics in terms of the anatomy, as well as from the blood supply or the vascular system or the veins under the eyes. Last, and is also important, as you asked in your question, is about the presence of an under eye bag. And that is essentially represented by an anatomic issue called lower eyelid fat prolapse. When there is a certain amount of lower eyelid fat prolapse, a lot of times the under eye bag is overlooked and the relative hollow is perceived as a dark circle. And so solutions, as you can appreciate from my describing each different type of anatomic condition, also are based on the anatomic issue that can be approached. So, for example, if we're dealing with pigmentation or skin quality, then there is a wide range of different lasers and technologies to be applied to treat the skin from that perspective, whether it's specific to the pigment or something to resurface the skin. When we look at the relative hollow in this area, well, injectable fillers, such as the use of Restylane, can help soften the transition between the bag and the hollow. If an under eye bag is so significant that it isn't treatable or manageable with a filler, well, then surgery is appropriate, and surgery such as something called transconjunctival blepharoplasty. So I think that although you are looking for some guidance by submitting a photo, I think it's very important to meet with a qualified, experienced doctor. I would suggest considering someone who is an oculoplastic surgeon, therefore who is a specialist in eyelids, who understands this area very, very well and is very experienced in this area, who can give you a thorough evaluation and explain to you what are the reasons for this issue with this perception of black eye. I think you'll find that to be helpful and help guide you as to how to approach this issue and see what kind of treatment strategy is best for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.